Well, good morning, depending on where you are, or good afternoon. I'm Bonnie Braun, and we're coming to you here from the campus of the University of Maryland, and we are supported by Iowa State's electronic system, and we are hosted, sponsored by, I guess you'd say, E-Extension's Creating Healthy Communities, Community of Practice. And we're grateful to them to invite us to do this webinar today. And before I forget, I would like to thank Marissa Stone for the work she did to help promote this ahead of time. I hope all of you got multiple meetings, notices of today, and we thank Marissa for what you did, and I see you've already welcomed people. As our check-in today, we are asking that you sign in. We'll have your name, your institution, put your email in there, and sort of what motivated you to join us today. And I see a number of you are already doing that. We're going to allow you a little bit of time here. We'll be watching to see. And our purpose for this is that we want to be able to, one, follow up with you afterwards and give you any additional information. And also we thought it was important for people who are on here with us today to know who is here live. So I want to welcome all of you who have taken time here today, but I also want to welcome those who will be listening to this as a recorded webinar. As is often the case, there were a number of people who just couldn't do it on this date, and so it will be available. And if some of you have colleagues that would like to view it afterwards, that's a possibility too. There is some intent by Marissa and the community of practice to even create some small segments as a result of this. And perhaps some of you saw two pieces of her work from our last webinar that we did, where she recorded the testaments and put those out as little mini YouTube videos. So we're not quite sure what we'll be doing with all this recording, but we hope to use it for multiple purposes in dissemination. Now, I still see there's at least one person typing, and thanks to everybody who's putting all this in there. I even wondered, Marissa, if you're going to be doing some tweeting during today. I didn't hear from you earlier. We didn't talk about that, but if you are, that'd be great. And if the rest of you tweet, this would be wonderful as well. Marissa is always telling us that it's such techniques as tweeting that make a difference. And yesterday, I was listening to, talking with Michelle Rodgers, who said she'd just come back from one of E-Extension's learning events out in California and become convinced that tweeting was important. So Michelle, when you're not on, I hope you'll tweet as well. So thank everybody for being here, for putting your information in, and I think now it's probably time for us to move on to what we intend to do with this today. This is one of the Save the Date cards that Marissa helped create for us. And as you can see, we want to talk about the impact of health and well-being and increase in individual confidence that potentially can occur because of smart choice. As Barb has reminded us, O'Neill from Rutgers, this is also Money Smart Week nationally. Financial literacy is important, and in fact, financial literacy and health literacy undergird the concept of health insurance literacy that Smart Choice addresses. So glad you all found us, and that's what we're typing to do today. I want you to know that as we do this, at any point in time, I would like for you to write either a specific question or a general question, or make some comment about what you have just heard. And we'll come back to that near the end. We'll be watching to see what you're asking or stating, and we'll come back to that because today we're not going to be able to have all of you on telephone to speak to each other. So we'll use that technique. Now, let's begin then with a headline from the Atlantic. Newly insured Americans don't understand basic health care terms. why increasing health literacy should be a national priority. Naturally, of course, that caught my attention, and well, why should it be? And she goes on to talk about how in the United States, our literacy is below average. It says, she calls it a dirty little secret that we are as low literate as we are, and particularly then when you start moving into health literacy, which costs us an enormous amount of money in the healthcare arena. And she finalizes with this, which I have circled here, writing as a clinical psychologist. She is concerned about how millions will find their way through the mass of information without the basic understanding they need to make good choices. And I think we have an answer for how some of those millions will find their way through. So that's the purpose of today. Now, to begin with, we invited Dr. Michelle Rodgers, who's the Associate Dean for Extension and Outreach at the University of Delaware. Michelle was there early on with an interest on behalf of her state and the Northeast region, which grew to beyond that region to become something national. And I've asked her to speak to us twice today. In this first piece, she's going to speak as a director who saw potential in this health insurance literacy initiative before we ever had it named Smart Choice. And so, Michelle, thank you for joining us today. We'd like to hear from you now.
Thank you, Bonnie. It is a pleasure to be able to join and to see the many things that this task force has done and the accomplishments. And just a few words of initiation. I think when we started talking this about 2 years ago, I, as others did as well, recognized that cooperative extension really had something to offer as our country struggles with this emerging issue of health and wellness, that this is a national trend and a national piece that where there's a need for information. And health insurance literacy was very upfront at that point, where we didn't even have our legislation finalized on that, but clearly an emerging issue that was going to impact all of America. So for me, probably having my roots in FCS as an agent at one time, and now with total responsibility for extension programs, really recognizing, I think, and starting to realize that cooperative extension could be in the next 100 years in the area of health what it has been to agriculture in the first 100 years. And we've talked a lot about that with the Centennial, but recognizing that there really is a grassroots need and a way for our programming to meet those needs around education, around the changes that are happening, not just with legislation, but just in taking care of oneself and what we're learning by research. So when we started this, I will say that the health insurance was clearly at the head of that list, but a broader concern. And later in the call, I'll talk about the breadth of health and wellness and where we think we're going with cooperative extension programming. But clearly, at the onset, even as an individual that considers myself educated, knew that I struggled with what all information was out there and where things would be, and that many others around me were also struggling. So both in caring for our own organization and for the public that we serve, just recognizing that I think we have a great deal to offer around health insurance literacy as we all struggle with change and moving forward with this. So I'm delighted with the task force work that has really embedded in this and developed a program and some evaluation that does indeed indicate we can make a difference. So thanks, Bonnie, for the chance to be involved in the dialogue and as we continue to move forward.
Well, you're most welcome, and thank you for your support all the way along. And this would be a good point to say that because of your support, Maria Pepitas, one of your extension educators, who happens to live in Maryland, but it works for the University of Delaware Extension, has been an active partner with us since the first day we sat down as an initiative team to address this, and we appreciate that. So let's take a look at another headline, this time from the Association of Certified Public Accountants, a very different group. There you go, Barb, Money Smart. What they have to say, they think their survey showed that half of U.S. adults were failing Health Insurance 101. They were particularly concerned that they were misidentifying or understanding common financial terms in plans. And so once again, it reinforces that this is an example of the kind of research we turned to in the early days to find out, well, what is the extent of the problem? And of course, this came along last summer as we were already moving ahead, and it just really reinforced that here's a very different take by CPAs, and they're concerned as well. A while ago, you heard the one from the psychologist, and now you hear one from a CPA. So health world, financial world, they're all concerned, hence health insurance literacy. Now, we also took a lot of our early information from Consumers Union, and more particularly from Lynn Quincy. Lynn, by the way, will be joining me at the University of Maryland's Personal Finance Seminar in May to address kind of where we are now and what she sees as she monitors from Consumers Reports perspective. And they came up with a lot of early and almost the only data that had been gleaned from some actual consumers. And I've posted about 3 of these here that we drew on heavily. The first one was that the area of greatest concern that they were seeing, Consumers Union, was that consumers were confused. They didn't understand vocabulary, they didn't understand concepts, and therefore, because they were confused, they didn't know how to make good decisions. So that was an early indicator for us that we needed to address that. A second one that they came up with was they concluded that there needed to be a framework or a map to help people work through tools like glossaries or any other tools, of which Smart Choice is chock full of, but they had to have a framework to make some sense with that. And so you're going to see how we created a mental map and have used that with consumers to help guide them, navigate them, if you will, through the complexity of something like a health insurance purchase. And then one more thing Consumers Union did was to remind all of us that they had learned from consumers it's not enough to have information. It's not enough to be clear about that information, that they have to trust who the information is from. And so I personally believed when I saw that we in Extension, where people do know us, the majority of time, we are highly trusted. Not only us as Extension personnel, but because we're associated with a university, which implies to people there is some kind of science base behind what we're saying and doing. So for me, this was an indicator that we could be the trusted source. We have no bias. We're not trying to sell you something. We're not trying to enroll you in anything. We're just trying to help educate you. So those were the sources we turned on to very early on. Then the University of Maryland Extension joined with Consumers Union to call together a group of people to help define the concept of health insurance literacy. And our third partner in that was the American Institutes for Research, who you will hear about later, the function they have performed since that day. And so some of your colleagues, there were people there from county, state, and USDA in financial literacy, people there from health literacy. There were people from not in Extension who had health literacy and financial literacy background, and we had people from health insurance plans. And this is the definition that we derived. It is very similar to the Institute of Medicine's definition of health literacy. One of the things that also makes it unique is it not only deals with the choice portion, which is A and B, but also the how to use the plan once enrolled. And you're going to hear about how we intend to address that part C later. But for right now, we're going to be focused on finding and evaluating information about health plans and then selecting the best plan for his or her family, financial, and health circumstances. This is also an important distinction that group in that room felt very strongly about that day, that it's got to be about what is best for that family and the individual helping to make the decision, and also best for their finances and best for their health. And we believe that's a distinguishing marker of Smart Choice Health Insurance. Then we took all of that background information, and under the leadership of Jenny Kim, who some of you know, who's a leader in personal finance, with a graduate student helping us, we delved into the literature that existed up to the point where this was submitted in the spring of 2013. So right at a year ago, we submitted this article, so it was current to that point. And the Family Consumer Science Research Journal chose to move it right up into publishing, and it came out in September, right as we were beginning all of this big push of our pilot test. So if you want to see more of the literature, more of the research behind what we did, you can turn to this. It also includes a review of the very few curricula that existed. And by the way, one of the big surprises we had was we thought we'd just go find someone's curriculum. And indeed, we found that we were going to have to create one ourselves. And so that's where you could turn if you wanted to know more about the research. We also said this has to be theoretically based. And so we started with a logical theory, the theories around adult education, which tell you something about how it has to be focused on problem solving, that they learn best by experiencing, that it's got to be grounded in reality, and that these adults have a wide range of literacy and numeracy skills. So that's where we started. Well, then we ask ourselves, well, is that an adequate theory for us to devise this? And we came to the conclusion, no, it was not. And so we drew on 4 other theories, the first being the social cognitive theory, which basically is about people believing that they can do this. It's called a doability factor, particularly in health literacy. It's not enough to know something, but can you actually do it? And so we kept saying as a premise, we've got to test this to find out if the doability factor is high. Social cognitive theory talks about confidence to act and to take control, and then feeling like you are in fact confident enough to do it. That led us to empowerment theory, because empowerment theory says that there are some things you need to do that help develop that autonomy and that self-confidence. And if you will do these things, the likelihood increases that people will believe they can and that they in fact can and do. So that's how those 2 theories fit together for us. Then we turned to evaluation theory, which told us a lot about, and she could probably say more about this, but about the need to incorporate evaluation from the very beginning. In the formative stages, looking at processes and what does evaluation tell you, as well as in outcome and impact focus. And so we brought evaluation in from the day our Health Insurance Literacy Initiative team began to meet in the summer of 2012. So now let's move on to what we then determined we had to do, which was write this up so people could do it and give them a criteria to evaluate the theories and the resulting materials. And I'm pleased to tell you that you will be able to go on our website and get the theoretical framework. When we did training of people, we learned that folks saw that this could be useful for them in all kinds of other program areas. So it'll be there as a new tool for you available this month. The result of all of that pre-work was that we created a framework. Remember, Lynn Quincy said they needed a framework or a map, so we did too. And we have a little formula, and I'm going to explain the formula. Those who are certified know this, but some of you don't, that we were going to reduce confusion, increase capability, and increase confidence, and that if we did all of that, we should see that people can do a smart choice. And so the pilot test that resulted from this development work is going to tell us if that is true. Now, as we bring up Teresa, I'd like to pause just a little bit to suggest that you go make comments about what you just heard or write any questions so that we could come back to that. So I see 2 or 3 people are writing, and we'll give you a little time for that, and then I'm going to turn it over to Teresa.
Okay, Bonnie, while people are typing, I'm going to go ahead and get started, but please feel free to keep typing into the chat box any comments or questions. If you think of comments or questions while I'm talking as well, please put those in the chat box. Before I get started, I do want to make some evaluation team acknowledgments, and like we often say about raising children, evaluation often takes a village as well, and we've had some wonderful support along this journey. Dr. Rama Radhakrishna from Penn State has been involved in the development of instruments, and then Dr. Kathy Paez and Ms. Jennifer Lucado from the American Institutes for Research have been involved in this project through the use of AIR measures, and we'll talk more about that just a little bit later on. Then Dr. Amanda Ginter, whom you're going to be hearing from, is a postdoctoral student and a faculty research associate with the project. And then we've had wonderful support from Allison Rowe, who's a data assistant that's been helping us with the data. But most of all, acknowledge and say thank you to all of you certified educators who have sent data in to us. We really appreciate the stellar job that you've been doing for us. One of the first things I wanted to talk about, and Bonnie talked about framework for the project, we also had an evaluation framework that we believe brings quality to this project. First of all, this was a significant project with potential to reach across the United States, potential to reach across multiple and diverse audiences. And we had me, the evaluator, embedded in the team. I have been embedded with the team from the very start. I've been a part of the training team and been in workshops to observe. We have subject matter experts, both in financial literacy and in health insurance literacy. We've had a research base, as Bonnie has already spoken to, about this topic and to help us to get started. And from that research base, then a program theory and a causal model that was developed. In addition, we've incorporated formative evaluation testing all along the way with our materials and our approach to the workshop. Again, we have reliable and valid measures. If any of you who have worked in evaluation, you know that the chance to have some reliable and valid measures to use is quite a wonderful thing for us in Extension. And then we've incorporated both qualitative and quantitative data and got the quality that having a mixed methods approach will bring. So all of this to tell you that Smart Choice was built with a quality evaluation framework as well. So one of the things, just kind of let's reminisce for a little bit, is 18 months ago, there were some of you who may have been sitting in another webinar, and we asked a couple of questions via a poll. One was, which of 3 areas were you willing to help with in terms of developing program and tools? And we had a public issues education question, a preventative care education, health insurance literacy. And you can see that we had people who were most interested in health insurance literacy. And then in addition, people were interested in teaching workshops to groups. So that feedback told us that there was enough interest to move forward with developing these workshop materials. So from there, we started working. Preliminary testing included our curriculum development with a logic model. I know some of you may not love logic models as much as I do, but we do have a logic model developed. We had formative evaluation, both with a material assessments tool and a curriculum assessments tool. Those are 2 tools that are within that evaluation framework manual that Bonnie told you about, so that's where you can access those. And then from all of the preliminary testing we had, this team took that data, we processed it, we sifted through it carefully, both the quantitative and the qualitative data, and that helped us to retool and get ready for the rollout of pilot testing with the curriculum. During the pilot testing, we had the curriculum with the measures from AIR. We gathered data. We've been analyzing the data, and that's going to help us be prepared for expanded programming, which we're going to talk about a little bit later in this webinar as well. But there you see both the logic model and the curriculum assessment tool and the material assessment tool instruments that we have used. So I put this slide here not just for you. I don't expect you, maybe you can't even read everything there, but I wanted to talk about the measures for a moment because this was the first time in my career that I had the privilege of having such trusted measures to use. And Bonnie said earlier on that they expected to maybe look out and find a curriculum that could be used that already existed. Well, they didn't, the team didn't find that. However, what we did find were these measures that the American Institutes for Research had developed. So I was very excited about that. They did all the pieces: environmental scanning, key informant interviews, focus groups, cognitive testing, pilot testing. I could get really excited when I start looking through all this again and talking about it. But I wanted to reinforce the quality of what's been involved in this project, and again, to acknowledge this significant work by AIR. This is a picture of one of the tools that's part of the curriculum. If you go through the certified training, you get access to all of this material. We have it available in paper instrument. It's also embedded as part of a presentation within PowerPoint that you're able to use clickers with. So all that's available. I know I saw several people who have not actually gone through the training, but just to let you know, if you do go through the training, this is part of the packages that's available to you, the instruments with the measures. They're ready to go. We also have a protocol that's ready to go as well. And by the way, you might be interested to know that it is IRB approved through Maryland. So we've taken care of that for you as well. So with that, I'm going to pause for a moment and let you type in any questions or comments that you have into that chat box as we prepare to hear from Lynn Little, an extension educator here at University of Maryland Extension. And she has actually also acted as co-PI on this project. And we're going to talk a little bit more now about the content and content development.
Thank you, Teresa. It's a pleasure to be here this afternoon, and I am privileged to be part of this project. I want to start by sharing a little bit more about the pilot testing that Teresa had alluded to with the evaluation piece. We here in Maryland had the opportunity in April of last year to take advantage of a teachable moment. It was our enrollment period that was going to take us from July through December last year, and we were able to use University of Maryland employees enrolled in State of Maryland insurance plans as our pilot testing sites on the College Park campus last spring. And as a result of that, we were able to test our curriculum. We used our PowerPoints. We had some case studies that we were working with. We've developed a workbook that we tested, some activities with the participants in small groups. We handled questions as well as tested our data collection methods using both paper assessments and the clicker versions of the assessments. So we used all of that preliminary data then to refine our Smart Choice curriculum and our workshops. And with the workshop, we have a focus that we are using for working with our consumers to explore the information that they need to make a smart choice health insurance decision for themselves and for their families. As we did this, we went back to the literature to be reminded of the need for helping consumers work through this process and the key word of being able to explore the necessary information that they needed. As we continue to work on and refine our curriculum, we turned back to the literature to be sure that we were understanding and meeting the needs of our consumers. And as a result of that, we developed 3 consumer objectives to help us meet the needs of our consumers in the workshop. The first of which was to do some analysis of personal and family health care needs and wants, and also to look at some financial aspects of that as well. To work through the consumer decision-making process of comparing some health insurance plans to determine what would be the best choice for each person and their families, and then to take all of that knowledge and information that they gain through the workshops to be able to make a smart choice on a personal level after they left the workshop. As we designed our workshops, we went back to the theories of adult education that Bonnie had shared with you earlier, and we used that to guide our work, knowing that we wanted to be able to deliver new information as well as to give our consumers or participants the opportunity to do something with that information. As most of you probably know, adults learn well when they have the opportunity for dialogue as well as working on solving their own problems and finding a way to put that knowledge and skill to application pretty soon after they've had exposure to it. So as we worked with our development of our curriculum, we planned our workshop so that we divided the material into segments, as you can see illustrated up here, where we introduced some content. We then worked with our participants to process that content through questions, small groups, working with discussion, learning from one another, then going on to review the content, reviewing key points together, drawing some conclusions, and making some decisions about how an individual would go about making a smart choice. As we looked at our mental map and thought about our framework of reducing confusion, increasing capability, and increasing confidence, it led us to developing these key questions that you see illustrated here on the slides in front of you. A why, a what, and a how. And as you can see, we were looking at the importance of health insurance, looking at the personal decision-making of needs and wants, and exploring what choices might be available to an individual, and then also looking at the affordability, how it fits into a spending plan, and what the actual cost of health care insurance and the associated cost would be for an individual. And so going through all of that, helping, again, that the individual will be able to make a smart choice as a result of participation in this workshop. A key component to the workshop to help consumers through the decision-making process was through what we created as a case study. We discovered that if you can take away some of the personal pieces of this and be a little more anonymous about the information, we had an opportunity to practice skills and develop the questions and the answers that an individual would need in order to go about choosing a health insurance plan that was going to best suit their needs. So we used a family case study. We looked at needs and wants. We had some sample plans, and we selected some worksheets from a workbook that we actually developed as an illustration of one of the worksheets up here in front of you. So what we discovered as we worked through the process of the pilot testing and so forth is that there was a need for a workbook that an individual could take away from the Smart Choice workshop and use on a personal level to make their own decisions about their health insurance needs, wants, and affordability based on the choices that were available to them. So we used the worksheets and went through some of the selected worksheets with the case study. And as you can see illustrated here, we at the same time looked at the need for helping participants to define insurance terms. And so the workbook has terms defined at the point of first use, and so you see several of those circled there. We also outlined some questions and things that we wanted our participants to look at as they go about making this decision. And we did a lot of this in small group work, encouraging our participants to learn from one another while using this common case study. As they worked through the small groups, they began to discover and realize that the conversations they were having in their small groups were very similar to conversations they were likely to have with their families as they went about this process after the workshop was over. At the end of the workshop, we provided all of the participants with the entire workbook that will take them from the needs and wants through the analysis and comparison to the bottom line of making that smart choice. And so we encourage them to take the workbook home with them using the knowledge and skills they gained during the workshop to be able to go about making their smart choice. One of the pieces of feedback that we got from our participants was that they wanted extra copies of the workbook to be able to take and share with other family members. It was also requested that perhaps it be posted on a website where it would be available as a standalone product as well. And so we have also accommodated that request, and you'll be hearing a little bit more about that as we move into some additional segments of the webinar this afternoon. So I'm going to transition now to bring Amanda Ginter on to share with us some information about our evaluation data. As we make that transition, again, we would invite you to make any comments or perhaps put some questions into the chat box. And we'll pause just a minute to give you an opportunity to do a little bit of that before we move into the next segment. Okay, joining me now is Amanda Ginter, who Teresa introduced as a member of our evaluation team at the start of our webinar today. Amanda has been receiving and analyzing the Smart Choice evaluation data that's been submitted up through the 31st of March by our certified Smart Choice educators, and Amanda is now going to share some of those results with us. Amanda?
Thank you very much, Lynn. So today we're going to be talking about the Smart Choice data that was collected between August 2013 and March 31st, 2014. And thank you to everyone who got that into us. We appreciate it. The primary methods of data collection are both paper and clicker, and both types were used in the analysis of demographics, which we'll be looking at next. So in this study, we had 636 workshop participants who agreed to participate, and we'll be reporting on 555 of them, and we had 6 states that supplied us data. So one of the questions that we were really interested in getting an answer to were, who were these participants? Who were they? And what we found was that predominantly participants were white women between the ages of 50 and 64 that did have health insurance.
This is really not surprising because our research shows that women are the primary health and health insurance decision makers for their families. So therefore, we have reached a target audience with our Smart Choice workshops.
We also found that participants are represented across all education and income levels.
From our pilot test, we know that we attracted a diverse population. So, Amanda, we'd like to find out how well the Smart Choice worked with across the diverse population.
And what we found was consumers' confidence levels did increase. And we measured consumers' confidence to make a smart choice on a scale of 1 to 4. 1 was not at all confident, and 4 was very confident. And we measured their confidence levels both at the very beginning of the program as well as at the very end. And the average pre-test score was 2.6. So right in between slightly confident and moderately confident. And following completion of the workshop, the average post-test score was 3.27, which is getting a lot closer to very confident.
Knowing that the #1 consumer problem that was identified by Consumers Union was confidence, we're pleased to see that the data shows an increase in confidence, and we certainly attribute that, at least in part, to the use of the case study that I described earlier.
Now, something else that we wanted to find out was, did consumers' confidence in understanding health insurance terms increase? And again, we measured this on a scale of 1 to 4, 1 being not at all confident and 4 being very confident. And we found that the difference in pre-test score was 2.52, which is between slightly and moderately confident, rose to 3.24 at the post-test. So again, getting a lot closer to being very confident in understanding health insurance terms.
In thinking back to the beginning of our webinar today, we talked about how consumers often have difficulty in understanding health insurance terms. So we intentionally focused on health insurance terminology throughout our workshop curriculum, and I illustrated that earlier with the circled definitions on one of our sample worksheets. In addition to that, we have some activities with participants that put together definitions, words, terminologies, and definitions. We provide a printed handout of 24 important words to know. As I said, the workbook has keywords defined at the point of first use. And we used the standard glossary that's provided by healthcare.gov so that we were certain that we were providing standardized definitions that people would be able to identify with. So I'd like to invite T to come back in and join us to share a perspective now on the workshop and the work with the certified educators.
Okay, thanks, Lynn and Amanda. It's very interesting. So where did all of this data come from, and how did we get this data? We've talked a little bit about that, but just let me go back and tell you that we recruited educators from all across the United States to be part of our I think about it as maybe our first wave of trainers, and we had great responses. There in these pictures, you see we had 5 classes producing 89 certified educators. Certified meaning that they attended our 2-day training workshop or 8 hours of training, experienced the consumer workshop themselves, and have gone back out now into their states to teach the classes. This was taking place during the time period of August through November 2013. So who are the states with certified educators at this point? Well, the green shows you where we have people that have been certified to teach Smart Choice. The white are states that we have yet to have certified educators in. We're hoping that over the next year we'll see all of those states turn green. But what we're going to do right now is just pause, and we're going to hear from 2 of our educators who have been involved with us. You're going to hear their perspective. Joining us first now is Barb Wolin from Iowa, who has delivered many, many workshops. She can probably, I think, tell you exactly how many. But she's been part of that stellar group, and so we wanted to start out today by asking her what compelled her to be part of our Smart Choice work. Barb, are you with us?
I sure am.
Oh, yes.
We got involved in Iowa. Our FCS field staff are specialized. So there are 11 of us who are family finance educators around the state. And a few of us were really paying attention and following the issue, knowing it was important, and then got in the loop, became aware of the national work that was going on. So we jumped on the bandwagon last spring when it came to piloting. Three of us did. And then we're really pleased that the Smart Choice curriculum would make it possible for us to move forward quickly to meet the need that we saw in our state. So we pushed really hard to get training done last September so we could launch in October. A few of us really got going in the fall. Others had to wait because of other programming commitments. But I'm guessing that we delivered Smart Choice to about 400 people through the fall months, October, November, December, in addition to some other outreach to some more specialized audiences using different lessons. One of the ways we accomplished that outreach was in partnership with libraries in our communities. And in addition, we asked, and most of our counties were willing to cover the bare bone costs of bringing us out to do the workshops. We didn't get all costs covered, but enough to cover mileage, and they picked up the printing costs, which was significant because the workbook is a big deal. And what happened then was that because we had all this experience and we had already been trained and brought up to speed on the ACA and so on, we were well positioned to apply when the Iowa Insurance Division had special federal funds for education and outreach. So we were one of 6 grantees. Our grant was about, I think, $180,000 for outreach that took place between January and March. In that outreach, Smart Choice was an important component, but not the only component. We needed some shorter lessons as well. as we go forward, we have no doubt that the need continues. People can change their insurance plan choice every year, and some people who jumped on one choice this year may discover it wasn't the best choice. In addition, new people will need insurance as years go by. So we're confident that this needs to continue to be a part of our programming, and we're working on our plan for that. But it's almost definite, it's certain that Smart Choice will be at least one of the components that we use as we proceed with additional training.
Okay, thanks, Barb. You said something that makes an evaluator very happy. You started out by saying you were following the issues. I would say you were doing environmental scanning, so congratulations on your partnerships and your funding and the ongoing programming. We're now going to be joined by Mia Russell. Mia is actually a University of Maryland Extension educator. Mia chose to work with a targeted audience in that she chose to target consumers through working with human resources managers and directors. So we wanted her to spend a few minutes talking to you about that approach. Mia?
Okay, thank you.
You're welcome.
So given that I'm on the health insurance literacy team in Maryland, one of the things that we discussed was actually making sure that our faculty and staff in all of our county offices also had an opportunity to participate in our sessions. So I started by working with the faculty and staff within our region or cluster during staff meetings. So I asked the local director for time in this normally scheduled staff meeting to kind of extend the time so that I could share the Smart Choice curriculum, given that it was time for open enrollment. And I was able to go to 4 counties within the state. The majority of our counties actually were probably trained. The majority of our faculty and staff have seen Smart Choice in some way. Additionally, I reached outside of the university to some HR managers and directors that I thought would have an interest in the program, and I had spoken with them before about other projects or topics. My focus is financial education, so I had talked to them about various topics from budgeting to retirement. And I also reached out to another university that initially thought they wanted to train the HR staff, but they actually, after learning more about Smart Choice, invited their admissions and finance teams as well. So it was, I thought I was starting out, my initial idea or goal was to reach out to HR managers because maybe their staff would want to better understand since they get a lot of questions from employees. But it changed in the process because the key contacts I spoke with saw that this was a greater benefit. So internally and externally, it looked a little different, but there was a lot of opportunity.
Okay, thank you very much, Mia, for that and for the wonderful work you're doing here in Maryland as well. So, remember, if you want more questions, I see questions coming in the chat box. We'll take those. We'll get back to those, but just keep those coming. So one of the other components of this Smart Choice, and some of you educators who have been involved with this may remember this, but the educator component was as intentional and as purposefully developed as the consumer piece. So we were eliciting feedback from our educators early on, and what we learned from them was that they thought that experiencing the consumer workshop themselves would be an important part of their training. So that component was built into the very first day of the workshop. So if you do, well, let me say, when you go through our workshop, you'll get to experience the consumer workshop for yourself. We had a logic model that was developed for the educators component, just as we did with the consumer component. Lynn Little, who you've already heard from, a curriculum development specialist, very instrumental in making sure that workshop was top quality and that educators would come out of that with a good experience. So let's talk a little bit about the data that we have then from our educators. When they were participants in the consumer workshop, we gave them the pre-test as well and then a post-test at the end of the workshop, consumer workshop. And you can see that on the pre-test, on that scale that Amanda has already referred to of 1 not at all confident to 4 very confident, they started out at about 2.7, somewhere just a little above slightly confident, little below moderately confident, and they moved to 3.25, moving toward very confident. And the scores are very similar to what we saw happen with consumers as well. In addition, when educators came into our workshop, we were eager to see and to ask questions about their confidence to teach Smart Choice. And as you all can see, I will not give up my day job as an evaluator to go into graphic arts. This was my rendition of a thermometer, if you didn't recognize it. But those are thermometers on those sheets of paper. And what we did was we did a temperature check at the very beginning. And you can see on that first in the top left corner, I asked people to let us know where they were at in their confidence to teach. And we had some people who put their Post-it notes right at the very bottom. They're just hanging on to that sheet of paper. So we took their temperature again at midpoint, and you can see with the Post-it notes that they're moving up. You probably can't see the writing on there, but what they were saying at that point is like, things are starting to make sense to me now. I'm getting this. And then by the end of the workshop, we had them at a temperature of around 85, which I said was, I'm ready to go out and do this. The very top of that at 98.6 was, I'm so confident I could do a train the trainer workshop. So you can see that we had upward movement, and that's what we were looking for. The second group, another example here, you can see that our educators started, we didn't have anybody hanging off the edge of that paper, but they were saying, kind of getting it, I feel a little lost and worried right now, but I'm okay. And then we had some people who started out feeling pretty confident. By the midpoint in that workshop, we've got people moving up to things are making sense to me. I'm almost ready to go out and do that first workshop. And then finally at the end, we've got people fairly confident that they're ready to go out and teach that workshop and maybe even pushing some people up to where they could teach a train the trainer. So what I'm looking for as evaluator is to see that line going up, and that's what we did see in our educators' confidence to teach this workshop. So what does that mean? Well, like those people who had their Post-it notes at the bottom of that first page who thought that they couldn't do this and ended up knowing that they could, you too could also teach Smart Choice, and this is our evidence that we hope convinces you of that. So back to our framework, guiding Smart Choice, as Bonnie, we talked about in the very beginning, and we had the formula here about reducing confusion and increasing capability and confidence, and that would get to a smart choice. Based on the data shared by Amanda and discussed by Amanda and Lynn, it's clear that consumers did increase their confidence and they increased perceived capability to make a smart choice. So the question now for the evaluator, turning the tables here, is, well, what accounts for this change? I get to answer my own question today. So remember, we started talking about that there was a theoretical framework that was undergirding this curriculum. We had research from social cognitive, empowerment theory, and all of that we used. We had a research base that was there. That's important to extension people because that's how we get our trust, and that's how we maintain our trust that Bonnie talked about earlier, that consumers need to trust the source of their information. So, in addition, The second piece of that was that we did pilot testing with consumers, and we listened to what they told us, and we incorporated that as we redeveloped the materials and made sure that what we were doing would work across a diverse audience. And then finally, we had articulated what we expected our outcomes, short-term, medium-term, long-term, what we believed would be accomplished. And we did accomplish what we expected in terms of those outcomes. So for an evaluator, one of the things that we talk about in evaluator language that we do is that we're looking to determine the merit of a program or a curriculum or a project. And in this case, merit, meaning quality, that's really how it's defined. The quality of the project is there. The quality is there. It is a curriculum of merit and of quality, as you can see evidenced by the data. And finally, let me take all that evaluator language and let's see, if you don't hang on to all of that, there's one line right here that sums it up. The Smart Choice curriculum is robust enough to work, and that's our bottom line today. So that's the important piece to remember. It is robust, and it's robust enough to work. All right, Bonnie. Back over to you.
Yeah, thank you very much. This is actually kind of exciting to see and hear it all put together, isn't it? And I can tell from your voice that you, as an evaluator, are excited about how this is coming out. And of course, reminding us that we wouldn't be able to say any of this if it hadn't been for the educators who did all the pilot
Absolutely.
testing and stuck with us and turned in that data. So once again, we do thank you for that. I'm going to turn our attention a little bit more to the future, and I've been watching some of the comments and questions, and we're going to deal with all of those in this segment one way or another. And while we began our work in 2011, we've been at this for 3 years, and we became in a formal initiative with some funding from the University of Maryland Extension in 2012. Our eye always was on 2014 because that's when the full impact of the Affordable Care Act was to go into place, and a number of the provisions that would affect all of us who have health insurance would be in place. And so here we are, it's 2014, and what a year it is, it's our year of celebrating our centennial. So we have something here that, as you said, is robust, it's very viable, and it could reach out and help a lot of people in this next year, depending on the extent to which we as Extension educators, specialists, administrators all make that happen. So marching on ahead in 2014, what can we expect or look forward to, which some of you have asked about? Well, we want to have more certified educators, number one. We'd like your face to be added to the classes next year, and we'd like to see the map filled in across the United States, like T said earlier. And to do that, we are going to be offering some certified educator training, which some of you have asked about. Colorado is hosting one in June, and I'm not sure if Sheila, if you are on, if you could comment about whether or not there's still space that others could join you or us or not. If not, we'll certainly follow up afterwards about that. Here in Maryland at the Ag Library on July 8th and 9th, we will host another training here. July 8th and 9th, Tuesday and Wednesday, July 8th and 9th. And then depending, Kansas has asked us to come out and do a workshop in Kansas in September, likely. And depending on how much demand they have, if there are seats available, that could be open to other people. Again, depending on demand, we can do one of two things. We can host another training here in Maryland in September, or if your state is like Kansas or Colorado or Minnesota was last year, you'd like to host and you'd like to have people come so that more of your people could get trained, but you would open it to others, we're open to considering doing that in September. But the only thing we can guarantee right now is July. We will be posting the registration information shortly, within a week, I think, up on our website. The early bird closes on July 1. The cost, as some of you have asked, it will be $225 for early bird. Between June 2nd and July 1st, it's $250. After July 1st, you need to ask us if we can accommodate you, because we're very committed to making this a quality learning experience for you, and we cannot have a room sort of too big that we can't do this, and if it's too small, we can't afford to do it. So it's $225 for early bird, and you could get that in on this year's budget, if that would help you any, and then you could have your actual travel here go in on next year's budget, and the $250 would be there between June and July, and then we have to see what it would cost afterwards. So I think that answers the questions you had about training. So the next thing, I guess we've moved right on, and the next thing is we're going to expand our product line, and so there's going to be a whole family of Smart Choice items, some of which will be what some of you might use when you're saying you want to have a smaller class, like Barb said she needed informational only type versus the type comprehensive behavior change type that Smart Choice is right now. We are
All right, we're going to do an audio test. It looks like we lost it there for a moment. Can you hear us, please? All right, go ahead and proceed. Sorry.
Thank you. There's enough yeses that we're going to move ahead. I'm not sure where you lost me. I was in the process of talking about new products and how we would be orienting those of you who are already certified to the new products via a conference call later in the summer. We will be orienting all of you who choose to become certified at your training. And I was also saying there's relatively few changes, just a few things we learned during this training or this testing, and we will also be adding some products, including a new scenario. Now, we are also in the process of getting the Smart Choice curriculum, the foundational curriculum to the product line, translated into Spanish, and we have 4 states on standby ready to do the testing of that so that we can find out if the Spanish translation works with multiple Spanish-speaking groups where there might be some differences in the words or the understanding, and we expect to have that ready for all of you next fall. We're also testing right now under Barb O'Neill's leadership the farm families, and that is an informational only. That is different than what Smart Choice, the basic line is, which is a consumer change model. This is to provide information to farm families for themselves and for themselves as producers and employers. Then we also have Smart Use, as I promised you, telling you about. We will be working on that this year, and it should be available for you to use in the off-season, as we're saying that, because we know that primarily people enroll in the fall. So this will be available in the spring. Some of you know that we have been producing a series of briefs that you can then modify for your state. There will be those available going forward. We have that website. There is the website address. Any of you who are not yet certified might not know about that address. That will be looking a little different within a week, because right there is where we'll put the enrollment for the certified educator on that. We also created, as a result of people saying, is there somewhere we can get questions answered after the workshop? And with the help of E-Extension, one of our educators here, Megan O'Neill, received a fellowship, and working with Marissa and some others through E-Extension, we were able to launch last summer the Ask Health Lit site, and that will be being continued to move ahead. We also expect, through Marissa's help and the community of practices help, to have more social media moving forward. We are looking at initiating or expanding partnerships. I think Cindy was asking a question about, like, have you worked with or communicated with? So we know some of you have worked with navigators. We here in Maryland are going to sit down and do some training for navigators. We've been approached by MARE Health about training. And the point of all of this is there are people that we've not even thought about, agencies, groups, organizations, who will probably embrace this and want to either learn it, as Mia was saying, so they can help their employees, or get people trained so that they can go out and reach consumers. And this will extend Extension's reach. We're also looking to see if we can find funding so that we can support the work being done much more extensively going forward, including data collection. And yes, that sets me up for, we will be measuring impact, because as T keeps saying to us, this is one of the few times in her experience that we've actually had such a great standardized instrument. And I think that very shortly there's a meeting with AIR to talk about factor analysis and whether or not we continue with the number of questions we have now, or if we can reduce those, if any of them need to be modified or deleted. And so there will be continued impact assessment going forward. Then we also need to be publicizing. We have a very brief window here. It started last fall, and we still got it this year. If the extension steps up, people can see us as a leader. So this is a way to position Extension. Here's just some things that happened on our own campus, including our own president tweeting. But we'll need to think much more extensively about our communication plans, collectively and individually, so that we really do position Extension going forward in this next century. And then we have a news that Barb announced on a previous webinar that the American Association of Family Consumer Sciences has selected Smart Choice Health Insurance for their 2014 Family Economics Resource Management Community Education Award winner, which is another piece of evidence that this is a sound product, and it was external peer reviewed, and they came to that conclusion. Now, I'm going to pause there before we move ahead, and I'm going to deal with a few more of your questions and comments as they've been coming in. So I'm going to ask my colleagues here to watch and help make sure we get them all attended to. Sheila asked about, once you're certified, can you train others, or is there another training? And yes, that is in fact a model that has been followed. When people get to the point they feel like they can, there's a way we can work with you for you to go ahead and to train other people. There was a question about taking away the personal pieces was a concern way back early on when Lynn was speaking about why we did this. And I think probably even in her presentation it wasn't quite as clear as to what she meant by that and why we turned to the use of scenarios. So I'm asking Lynn to address that, please.
In the workshop, we used the strategy of providing information and guiding participants in making a health insurance decision using the case study. We did the case study so that we have the opportunity for people to practice in an anonymous and less committed way without feeling like they needed to be sharing a lot of their personal information. In our very early pilot testing, we tried doing some individual personalized work and found that we got so bogged down, and the participants got so bogged down in their individual circumstances that it was difficult to get to the key pieces of the decision making. And we have found that with the anonymous family developed case study that it really has been much more successful in people walking away understanding how to go through the process on their own, using the workbook for the personal side of that. So I hope that addresses that question. And Mary Jo had raised the question about the second case study, and we are just beginning to test that second case study, but that one is designed with a family that could be eligible for tax credits, and we are using sample plans that would be available on the marketplace. And so there's several subtle changes to the case study. It's not dramatically different, but the income levels and the tax credit piece and the sample plans we're using are slightly different. And like I said, we've just begun to test that, so we're hoping to have it ready to be released here later in the summer or early fall.
Good. Thank you for that. Brenda asked about the Spanish version, and that is going to be tested somewhere as soon as we get it translated. We're in negotiations about that right now, and it will be tested. Let's see if I can remember the 4 states: New Mexico, Iowa, Minnesota, and one more who's is eluding me. So it will be available in the fall for others to use, but not right now. And you also asked about other languages. I'm having to laugh. It's enough to get Extension to put up the money to help us get this translated. If we want this translated across the nation and in other languages, that is something we're going to have to take on, because there's a very real cost associated with that, and it's more than our state can bear. So we're going to have to look at that as a part of our partnerships together. Early on there, someone asked about the cost of copies and coloring it, and yes, there is a cost to quality and look, and we were very deliberate. We looked at a lot of papers, we looked at a lot of colors, we hired a graphic artist to create the look of all of this, and we have come to believe that the color matters, and we have found low-cost arrangements for this that can be done collectively, and some states have found it. And so about the cost of a workbook is about $5. That can be covered by your Extension budget, or if we go for outside money, individually or collectively. And in many places, $5 or maybe $10 is not an unreasonable amount to charge. We have places in our state where people will gladly pay that amount. So the standard is high because we are trying to make inroads with people who don't even know Extension exists, and to come away with a positive impression. So that will be our recommendation. Let's see, Cindy, I think you raised a question about a guidebook that was put out for federal employees. Well, for one thing, that's for federal employees, and it is very specific to the federal plans. Smart Choice talks about general plans. We did not get into any specifics other than, for example, we in our state used some Maryland examples, and we encouraged other states to do that as well. So it's different, I believe, because the emphasis in Smart Choice is not the individual plan. The emphasis is on how to make a choice of a plan and how to match it to your family's needs. And then, Cindy, you also were talking about if people have coordinated this, provided referrals, and I saw at least Deborah Wood spoke to that. If any of the rest of you have provided that kind of referral, I think Cindy would really like to know about that, so please use your part to write about. Now, my colleagues have been looking at a number of things coming in. I haven't had the time to look at that. And so is there anything more that we need to answer right now? Oh, yes, I see, Cindy. Yes, it is worth looking about, but it is definitely different. And you wanted to know if we had. Well, it wasn't. That was for 2014, and we had already created and launched this last summer. So it would be something for us to look at now to see if moving forward, and we certainly will do that. So thank you for that point. It might be that we're talking, as Barb says, maybe even the format. And so certainly those things are the kind of what we call the modifying to improve the look and functionality, but content-wise, we don't expect to be changing much going forward. Is there anything else that you all say we ought to?
You want to address Joyce's?
I think she just...
There is, Joyce, when we do the training, we explain that that is one of the things that you should be doing, is helping to see, as you debrief with the scenario, you're going to find that different groups chose a different plan. So that becomes the perfect teachable moment to talk about why you came to a different conclusion, given the same set of circumstances. That's another reason for standardized scenarios. Given the same circumstances, reasonable people came to different conclusions, and that's okay. That's how it will be. And so we reinforce that.
Yeah.
So thank you for asking that.
And thank you for supporting the scenario approach too. Yeah. You echoed what we had were thinking.
Oh, yes, Donna, if you come to our Certified Educator Workshop, we're going to deal with that rather extensively about the dynamics of groups, how you manage it. We can tell you, for example, we learned firsthand you don't start with the questions out loud in front of the group. And on the last webinar we had a brave enough certified educator to say, I deviated from how it was to be delivered, I opened it up, and I'll never do that again. And so we will be sharing all those kinds of stories. And in fact, we're hoping we can garner more stories from the certified educators as a series of interviews are conducted this month. All right, then I think it's time now, because we're drawing down to our last 15 minutes. I want to be sure that we hear from Michelle Rodgers again, and we can come back if there's some other things to talk about. Your chat box is open. Please feel free to continue to make any comments or raise questions. So if we could move ahead. All right, it's time to hear again from Michelle. And Michelle, we will forward the slides when you're ready to speak to them. Are you there?
Yes, I'm here, and hopefully you can hear me, and we'll just wrap up with a few things here about how this ties in now to some work that's been done nationally in terms of where we go with programming for health and wellness in cooperative extension. And it really is exciting. As we've talked about, so much of this happens as you're working on it. It's an iterative process, but it also is kind of like whitewater. You're creating it as you go. And we've talked often about how that is with our work today, is that we have to create things while it's happening around us and have it be meaningful. So as you move to the next slide, I just want to say that it's been, while we've been working on the health insurance literacy piece, we've also simultaneously been working on what will be a framework for Extension Second Century regarding health and wellness. And where does all this fit into? Where does the health insurance literacy piece fit into Extension's work? How do we formalize that? How do we get impact that we can share across the country to make it meaningful for Extension to be involved? And so while this, we've been working and moving forward in one arena, there's been a larger conversation happening nationally around where Extension could and should and might be in the future. There's a task force that was charged by the Extension Committee on Policy. At that time, the chair of that group was Daryl Buchholz from Kansas, who said, we think we have a role for Extension in health, but what is it and what should that look like? And so for the past 15 months, that task force has been working, and the recommendations of that task force came forward just the last week of March to ECOP, and I'm happy to share that that has been fully approved, and we are moving forward with the implementation of that. So I think it's time right now, if you want to move to, we have a one-page model that I think summarizes and ties this in terms of how what has just been talked about is framed within where cooperative extension is going nationally. And so this one-page model is just a very brief, I'm going to just take a few minutes to talk about where we're going with health and wellness. As I said, these recommendations were made to ECOP just a week ago. They've been approved, and the committee's meeting tomorrow to begin talking about how we communicate across the system. So you're hearing this first in terms of how we can start communicating and have further discussion about how we implement these recommendations. This is a model that's built on the National Prevention Strategy Action Plan and ties extension well into that national plan and a number of public and private organizations that are involved in supporting that national plan. And at the center of this plan is that Extension's mission and goal would be to increase the number of Americans who are healthy at every stage of life. And that's what's in the National Prevention Strategy, and we agree that that fundamentally fits very well with the mission of cooperative extension and the education that we can provide. The second circle out from the center, kind of green on your screen, recognizes a lot of discussion that we've had today that The environment that we're working in with health insurance is not just about individuals making choices, but it's also highly impacted by the community, by what state that you're in, what the rules and regulations are in the state, what the state is offering is a very big factor. And so recognizing that whatever we do in health and wellness across the country, we really need to look at more than just behavior change. It is about healthy and safe choices that individuals make, but it's also about what the environment is and how we can create a healthy and safe environment where people can make better choices. And so it's about informing policymakers about the choices their state has and how that impacts the total population and how we work in that. So in this total model, we've talked about these, both what we call the social ecological model, which is not new to many of you in terms of how we move ahead and not just focusing on the individual, but on the community as well. Which reaches then out to the third ring of our model, which is around extension priorities. And I just draw your attention to the priority in orange at the 2 o'clock on the circle there. It is health literacy, and then opposite at about 7 o'clock, you'll see health insurance literacy. And so we have identified that there is a need for people to about health education and the basics of how to be preventative in their health and maintain health, as well as health insurance literacy, which relates very strongly to the Smart Choices curriculum that you've just heard. And what we're most excited about is the model that has happened with the health insurance literacy, that this was a program that was identified as a need. It was then taken and developed on a theoretical basis, and you've heard about the theoretical basis. In addition to that, it was built in with impact and evaluation, that we were able to measure it across the states, multiple states who were involved, and that has been built into it. And we're able to report out that data not only by individual states, but also collectively as cooperative extension. So as we look at this model, the health insurance literacy piece that you just heard about, this is one example of health insurance literacy. Obviously, there's other components and other pieces, but Smart Choices that you've just heard about forms a framework of one of these 6 priority areas. And not only the curriculum, but also the concept of the development of it, the further development of branches beyond it in terms of the farm families, the multiple languages, and how you use it, taking that and building on from that, but specifically also that we are measuring for impact and using tools that can be used across the states to say how cooperative extension is making a difference nationally is really a great opportunity for us as we move forward. So there are, in the orange circle, there are 6 priorities, just drawing your attention that this health insurance literacy is one of those 6 areas that have been agreed to by the directors across the country as a priority. Health literacy is another. You'll see chronic disease prevention and management is an area. Positive youth development is an area, and positive youth development for health particularly. And I remind everyone that the in 4-H is head, heart, hands, and the 4th H is health. And we've always been about health, and we have some very exciting programs, and we've had a great opportunity to work with the National 4-H Council, who's very willing to generate and work side by side and hand with us for both adult and youth programming around this whole health arena. So they've been a great player, and most recently we put in place a grant with ConAgra, which is about food smart families. And while it may be more related to the nutrition side, it has this health component of physical activity in it. So really looking at that piece. Also, you'll see health policy issues education. That's another strategic area in terms of helping people understand how to be engaged in policy, the policy arena that makes the decisions around which they're impacted. And it's an important part of knowing about health and decision making is in how to engage in the policy with that. And the area at 12 noon on the circle is called Integrated Nutrition, Health, Environment, and Agricultural Systems. And this is overall recognizing that the integration of the food systems and all the work that we do, whether it's on climate change or whether it's on environmental issues, whether it's on health, that they are all integrated and that this across our area, that this isn't just an FCS responsibility to a framework around health, but it is across, and we know that in agriculture, we know that health and wellness issues with animals and physiology has the One Health concept has an impact on human health, and what dimension does that have? And there's a variety of ways that our work is integrated. So we're really looking at how do we in the cooperative extension system integrate our work and move across our silos that we sometimes create ourselves to see our work as impacting, again, this community ecological approach which we can all bring something to the table. So they are the 6 priority areas that have been identified in the future. And on today's webinar, I think it's just important to indicate that, that this health insurance literacy is one of those. We know that not all states, including the one that I'm serving in Delaware, are we equipped to be working in all 6 of these priority areas. So we know that states will pick and choose which areas that are most effective and meaningful for them and where they want to be involved. And we're hoping that our implementation team that will be put in place with this will help us establish a national framework where we can take states that are leading, such as Maryland has led on this health insurance literacy, but states can lead some of these areas and would help us move forward in that. And then the outside ring, just very quickly, you will see is about recognizing that we may need to partner in ways that we have not done before. I think you heard a little bit of that mentioned in the webinar today with Mia talking about different groups that she's reaching out to that might be interested in this information. They were private organizations and public organizations that we maybe have not worked with before. Our connections with public health and where are we in terms of standing side by side with them around this. I've met with our Department of Public Health here in Delaware, and they're very interested in our health insurance literacy information because it's not something they have been focused on, but would welcome our expertise in some of their regional health centers. So again, looking at more broadly as a system how we can connect, and I won't go into great detail, but certainly looking at the primary care extension program that has been authorized but not funded necessarily, and the Affordable Care Act does look at how extension is going to be involved nationally in that realm, and making sure that we're at the table in discussion as that moves forward around what areas we can bring to that primary care extension health program. And these 6 areas are what we can bring to the table in terms of our work with them. So I'll just wrap that up by saying this is the national framework. We hope to be doing more communicating about that through webinars, through the Creating Healthy Communities, through other resources and opportunities that the implementation team designates and develops as we move forward. But I thought it'd be helpful for you to know that while we're working through this new area, we're also looking as an organization and system about where we go nationally and how this does tie into that. And I'm pleased to say that the results and the recommendations of these 6 priority areas have been approved, and health insurance literacy will most definitely be one of the ways that we move forward as states select which pieces they're going to be involved in. So Bonnie, I'll turn it back over to you. I lost my computer connection, so I'm not able to see the questions, but I'll be glad to respond to anything.
All right. Thank you so much. That was really great that all of us could get to see what only a few of us have seen to date, which is that new framework. You're going to be hearing about that in multiple ways. You certainly have set up for us, Michelle, how Health Smart fits in, and if anyone was holding back from getting involved because you didn't know if this is a priority, she just said it's a priority. And so now we need to figure out how to make that happen. And I want to also acknowledge that Cindy Reeves, who is on here today but didn't orally speak, she co-chaired with Michelle that task force, and they have led us well, I think, going forward. So thank you very much to both of you. Now, if another reason you're holding back is you're really wanting to judge whether or not this is a quality program, our extension evaluator said it is. High quality, high merit, highly effective. It's moving people in the direction that the research had said was problematic. We're taking care of that gap, solving that problem. If you said, well, I can't get involved because I can't do the training, because I'm not trained, I don't know much about it, as at least one of you said, as she also demonstrated, we can take you from off the page to confident that you can if you'll participate in our crafted certified training. So the bottom line of all of this is it was wonderful to do a pilot. We know we have a quality product, but it is not worth anything if it isn't delivered in this next year, this and other pieces that are coming forward. So we are making a plea to our own people here in Maryland and to many of you, because we also know there were a lot of certified educators trained but who haven't actually delivered. This is a year to step up. This is the year you can make a difference in people's lives. As Lynn often reminds us, this is not just about learning to make a decision about health insurance, it's learning how to make smart decisions, and it just happens that the context for the moment is around health insurance. We didn't get to everyone's comments and your questions. We will be pulling this off and taking a look at it, and you can expect if you gave us your name and in particular your email, and if you haven't done that, please find Dawn and do that. You will be hearing from us, and we'll try to answer your question that way. Or if you'd like to get a hold of me, you can contact me at bbraun@umd.edu. We are very grateful that all of you were here today and that we had the team of the Creating Healthy Communities behind us. As Michelle said, we are moving towards trying to create healthy communities in the future. And we would welcome more of you joining that community of practice if you're not currently a member of that. Thank you to Iowa State for your technical assistance in making this happen. Thank you to all of you who spoke up, to Barb and to Mia out there calling in, and to Michelle. We appreciate your interest, your support, and we look forward to working with you going forward. And we hope that each of you will make a smart choice to be a part of this. Thank you, everybody.